thought I'd start by thinking about sort of putting out some of the facts, which you've heard here and there. We're 50 years out on the war on poverty. What do we know? We know that New York is not where we want it to be yet. We fall behind all of our neighboring Northeast states in indicators of child well-being, according to the Annie Casey Foundation. Poor kids may make sicker adults. Cornell researchers found that the longer 13-year-olds have lived in poverty, the less efficient their bodies become in handling environmental demands. At the same time, and I always want to remember to kind of call this out, New York has been a real leader in ensuring that our children have health insurance coverage.
My expertise really is in, and my advocacy and my work has been in human rights, specifically around women's rights, but also the idea that constitutions and law can make a difference in the lives of people, and particularly poor people. What I really wanted to do was sort of say three things about this issue of poverty, and particularly the right to education and what poverty does for poor people. And I think that the first is I would say that I would center this idea of education as a right. Certainly since the establishment of the United Nations and the Universal Declaration of Human Rights and other international instruments, it's clear that human rights, to focus on the right, provides an organizing principles for individuals and communities to organize around. Mr. Kozel spoke about Brown versus Board of Education and referring to some of the gains here. It's so interesting because when I was a university student and a law student in South Africa, it was in fact the civil rights movement in this country and the Brown and the Civil Rights Act that influenced much of what we eventually did in our Constitution. And we have ensured that affirmative action and all the battles that you fight here are not going to be fought, so it's sort of in a document. The second point I want to make is that the right to education, and I think you alluded to that, doesn't stand on its own. The right to education is a precondition for the enjoyment of all other rights. The right to vote, the right to freedom of association, and in fact, the right to engage and access resources to transform the lives of people. I think in the United States, my observation has been, and I think it's a worrying trend, that increasingly people see government as a force of not good or evil in some parts. But I think in the rest of the world, and particularly transformative societies like South Africa, but even in the old democracies, there is a notion that government can and should do good, and that we as citizens have to ensure that government provides, and that we also take responsibility for our lives. But the relationship between citizen and government, I think, is an important one. And the right to education is linked to the way that we live our lives, how tolerant we are of other people's viewpoints, how tolerant we are of other people's foibles and weaknesses. The third point I want to make is that certainly in the world at which we live beyond New York, but also New York, but more importantly, I think beyond New York, this idea of education and women. And that's what I feel most profoundly about. You've all read about this young woman, Malala Yousafzai, who was shot by the Taliban, and she's become a sort of international icon. But the right to education is so basic and so absent because of the fact that people are women. And this is a battle that is going on, I think, in parts of this country, but certainly in many parts of the world.
There's so many avenues through which poverty can reach children's development, and they tangle with one another, and they interact, and over time they strengthen, and they get worse unless we intervene. So children's development is derailed, and they're unable to attain their educational and social success that they would have been able to attain had they not been in a situation of poverty. So this complexity of the entanglement of risk, of psychosocial risk and physical risk around children's development is so complicated and scary that good people, I think, throw up their hands. They say, there's nothing we can do. There is a burgeoning body of literature that is beginning to point out what we can do. And the social return on investment literature and benefit cost analyses literature that was born in the preschool longitudinal studies that probably most of you know. There's studies that followed children who were in poverty. Some of the children were randomized into preschool programs, excellent high-quality programs. These kids were followed in 3 different studies over until they're adult, their 30s, 40s, and 50s at this point. And there are still differences that are found only due to the preschool program. And those kids who got lucky enough to have that great early childhood program, they are earning more money. They are in jail less. They had fewer children as teenagers. Some of them went to college more often than the comparison group children. They're just doing a whole lot better. We have nurse-family partnership with longitudinal outcomes, where we know that the moms space their children better, that the children are healthier, that they're safer. And we know that the kids in Elmira, when they became teenagers, were going to jail at something like 60% less. There are programs that can be implemented. There are programs that can be ramped up so that everyone in need has access. And when those things happen, you'll have families that are more supported.
I want to talk from a perspective of a clinician and an administrator. I'm a pediatrician, and I work in the South Bronx in some of these communities that Dr. Kozel had mentioned. And I'm also a clinician in a school in the South Bronx, so I can tell you what I see when the kids come into the room. I have children that live in 3-bedroom apartments with 3 families living in each room of 2 or 3 children each, where the kitchen is shared by a family in the night. And if it's not your family's turn to use the kitchen that night, you get a snack, not a meal. I see the effects of poverty in my daily work. I'll tell you a story that the economic recession hit the Bronx more than most other communities. We're already suffering. We're 62 out of 62 in the counties in all indicators that affect health and socioeconomic well-being. I refuse to give up hope, and I'll talk as an administrator. When Mr. Kozel mentioned about continuity of care, I smiled and I said, welcome to my world. As an administrator, things are happening, and that's what gives me hope. We now have something called a patient-centered medical home. That is a concept where kids are really followed, families are followed. The care he talks about, the asthma are managed, the preventive care is done, the health, the visions are done. And this is happening even in the Bronx. The child will tell you, doctor, you know what? It's hard, but I'm going to make it. He just needs you to say, yes, you can. And that we can do without any policy. And we don't have enough adults that do that. All of us here can do something. You don't need to wait for that policy. You just need to ask them, how are you doing? Some of the kids don't get that.
Many of the policy solutions that we hear from the ed reform camp right now, which really, again, as I was saying, does dominate the mainstream conversation. These are solutions like more testing, like closing schools, like thinking of alternative ways to credentialize teaching force. I want to propose a different set of solutions. So 2 concepts. The first one is called the opportunity gap. What we at the Opportunity to Learn campaign think, and at the Schott Foundation, is that we have wrongly focused our conversation for 30 years on the achievement gap. And instead, we should be looking at the opportunity gap. What I want to talk about is this concept of closing the opportunity gap first. And that is, these are evidence-based programs that we absolutely know work. Everyone on this panel, including Jonathan, just talked in detail about them. High quality, and that's critical, high quality early education programs. If all kids, especially poor kids, had opportunities to early childhood education programs, we would absolutely close the achievement gap. Got to close the opportunity gap. High quality teaching, and I'm not talking about teaching in the way that we often talk about it, but I'm talking about it in the way that Jonathan is talking about it, where teachers are responsible for building on curiosity and building on the joy of natural intellectual curiosity. And we're talking about, the term of the moment is college-bound curriculum. Very important to have college-bound curriculum. Common Core standards will get us to a college-bound curriculum. Well, when I talk about college-bound curriculum, I mean interesting, intellectually interesting and engaging work that meets students where they are and what they're excited about to enhance the learning process. Because I want to jump to my second concept here, which is, again, building off of what everyone on this panel has talked about. These are actual policy solutions for closing this opportunity gap. As we've talked about for the last 30 years, the conversation has been on standard-based reform. What we want to do at the Schott Foundation is encourage us all to think not about standard-based reform, but support-based reform. What would support-based reform look like? What would it look like if we really supported teachers, students, and families in, and again, acknowledging poverty for what it is, not using it as an excuse not to learn, but to then figure out what are those appropriate supports to enhance that education experience. So there's 3 categories. Again, we've talked about all of them, so I'm going to run through them quickly. Health checks, vision, nutrition. We've talked about nutrition. We've talked about vision, dental, asthma. Let me just leave you that these are policies we can implement at the district, state, and federal level. While the federal government is asking our young people to race to the top, I think we're suggesting that actually the federal government can have incentives for creating these supports at the state level. So Mississippi, California, Massachusetts, that all of those kids will have the supports they need.